I do think mobile working provides an excellent opportunity for the future, and I've seen examples where it's working, it's already working to improve patient care, both in hospitals, both with nurses and clinicians having access to this sort of technology, but also in the community where community nurses can take this sort of technology to the benefit of patients into their own homes rather than having to carry vast pockets or parcels of paperwork with them. Well, we're not terribly keen on a centralised IT system. We think it's run out of control in terms of cost. It hasn't delivered in the timescales that it was supposed to. We'd much prefer to see localised IT systems which reflect the needs of respective hospitals or primary care facilities, but also they must have an ability for information to flow across those various systems. So if you like, a series of laptops rather than a central server, and the technology does exist to do that, and we're consulting on how that actually might work in practice. And we think that taxpayers' money would be spent much better in that sort of format rather than trying to deliver a centralised IT system, which we think inevitably will not work in practice. Well, I think what we've got to do is we've got to celebrate the achievements of many of our excellent National Health Service hospitals. And the way to do that is by putting the information that supports the excellent service they're providing in the public domain in an easily understandable way that patients can access. So patients can then see where hospitals are achieving, both in a microcosm of individual wards in hospitals, but also generically in hospitals, and also where hospitals are not achieving, because I think that will deliver this sort of ratchet effect that we were talking about earlier with competitiveness within the National Health Service system, but also providing patients with choice to move to where they think the service that is appropriate to them is being delivered best. So we should celebrate where excellent service is being delivered, but we should also put that information into the public domain, as well as information about where services are not being delivered to the standard that patients should and could expect. I do support the sharing of best practice, and I think if there's one thing that strikes me as I travel around the country, it's that there is some excellent pockets of very innovative work that are taking place both in the acute and the primary sector. But the NHS seems very slow at taking that best practice and spreading it across the widest possible spectrum as fast as practically possible. And we need to find ways of assimilating that information and disseminating it so that people benefit and patients can benefit from it in the widest possible geographical area to the excellent innovative work that is being done in some small pockets in this country. Well, I'm in favour of greater mobile working, and I think that both in hospitals and in community settings there is a significantly enhanced role for mobile working, and I think that the tariff structure may well have to change to incentivise more innovative working, to not be based on activity levels but be based and rewarded on patient outcomes. And if there's the better patient outcomes being delivered by using new technology and innovation such as mobile working, then that should be encouraged through the funding flows that we intend to deliver.